You can literally die from a broken heart, and it's called broken heart syndrome, and it does not affect males and females equally. So what would you guess? Does it affect males or females more? Well, we'll answer that question shortly, as well as discuss what broken heart syndrome actually is and what is thought to potentially cause it. Could it be that horrible breakup that you went through, or is it something else? It's going to be a heartfelt one. So let's jump into this anatomical awesomeness. So what is broken heart syndrome? Broken heart syndrome is technically known as Takotsubo Cardiomyopathy, which is Japanese for a heart muscle problem that looks like an octopus trap. And you might be thinking, what in the world does that mean? Well, it's actually a pretty good name because with broken heart syndrome, the heart actually changes its shape and balloons out. And it does in fact look like the pot that's used to catch octopus. But in order for us to have a better understanding of what's going on here, we need to cover some important heart anatomy. So here you can see a real human heart. And the heart is made up of 4 chambers, 2 atrial chambers, so a right and left atrium, and 2 ventricular chambers, so a right and left ventricle. The right side of the heart is essentially dealing with deoxygenated blood that's returning from the body tissues. The right atrium that you can see here will gather that deoxygenated blood, and then that blood will pass through the tricuspid valve and into the right ventricle that you can see the probe in now. The right ventricle will then pump that blood through the pulmonary trunk into the lungs. We then breathe out the carbon dioxide, breathe in some oxygen, and then that blood will go back to the left atrium, which you can see here. And remember, we now have oxygenated blood. That oxygenated blood will move from the left atrium and into the left ventricle. And then the left ventricle will pump and squeeze that blood into the garden-sized hose of an artery that you can see here called the aorta. I mean, just look at how massive this artery is. It's incredible. But another really cool thing that you can notice here is look at the size difference in the right ventricle versus the size of the left ventricle. The muscular wall of the right ventricle is noticeably thinner than the muscular wall of the left ventricle. And this is because the right ventricle only has to pump blood right next door to the lungs, whereas the left ventricle has to pump blood to the entire body. So it has to be stronger. And this left ventricle is going to be important for our story, with one other thing that I need to point out, which is the actual point of the heart that you can see here called the apex of the heart. And both of these are going to play an extremely important role with Takotsubo Cardiomyopathy or broken heart syndrome. So then what's actually happening with broken heart syndrome? Well, we don't totally know because the pathophysiology is still not fully understood. But I'm not going to leave you completely hanging here because we do know some things. Like we do know that a patient usually suffers from some kind of emotional or physical trauma beforehand. So yes, this could be a horrible breakup or a horrible divorce. Or maybe the IRS contacts you for an immense amount of back taxes. Maybe you lose a job, or maybe you lose a loved one, or even physical stressors like surgery or a severe illness. But besides this emotional or physical trauma, we do find the presence of something called catecholamines. And these are going to be substances such as epinephrine and norepinephrine, which you have likely heard of by their other names, adrenaline and noradrenaline. And this does make sense to a certain degree, because if you're experiencing an emotional or physical trauma, adrenaline levels are going to spike, which increases heart rate and blood pressure. And so it could actually be that this surge in adrenaline and the presence of all these catecholamines is one of the causes of Takotsubo cardiomyopathy. And research suggests this adrenaline overload might stun the heart muscle combined with factors like microvascular spasms or hormonal shifts. It's kind of like your heart going into panic mode and revving too hard from stress. And we do see elevated levels of catecholamines in other heart conditions, so it kind of seems plausible that too much adrenaline could literally cause you or your heart to break, so to speak. But at the same time, most people that undergo extreme stress don't actually get broken heart syndrome. And so yes, adrenaline probably plays a role, but this is likely due to multiple things all happening at once rather than just the presence of adrenaline alone. So regardless of what causes broken heart syndrome, what actually happens to the heart? Well, that pointed portion of the heart that we learned earlier, called the apex, balloons out. But not only does it balloon out, this upper portion of the left ventricle, called the base, is going to contract. So if you have this contractor and this ballooning at the same time, that's what gives that typical octopus trap shape. The problem with this, besides the fact that the heart is literally getting bigger, is that when the apex balloons out, it no longer is going to be able to contract effectively, meaning it's not going to be able to eject an adequate amount of blood out to the aorta to be delivered to the rest of the body. This drops the ejection fraction, or the volume of blood ejected with each beat, and starves your body of oxygen-rich blood, kind of like a pump that's half clogged. Now, broken heart syndrome can be difficult to diagnose, especially in its early stages. And this is because the symptoms are so closely aligned with other types of heart conditions, such as a heart attack. One can experience chest pain and shortness of breath, for instance, with broken heart syndrome. And so this means that the way to properly diagnose whether you're having a heart attack or some other heart failure or Takotsubo Cardiomyopathy is to do tests, such as an ECG, echocardiogram, an angiogram, or possibly even an MRI. But now, let's finally answer whether this affects males or females more commonly. Well, it affects females 80 to 90% of the time, especially post-menopausal females. Now, you may be wondering, why does it affect females, and especially post-menopausal females more? And again, we don't totally know why, but emerging research points to estrogen having a protective role. But as estrogen levels decrease after menopause, this could make women's hearts more vulnerable to stress surges. And probably one of the more important things we need to talk about is, what is the outcome if someone develops this condition? Well, you're not all that likely to die from it, as it has a low mortality rate of around 1 to 5%. And so most patients fully recover, unless they have some underlying condition. So it has a good prognosis when you compare it to other heart conditions, such as a heart attack or other types of heart failure. In fact, the left ventricle, more or less, will return to normal after a few months of rest and some medications such as beta blockers. So yes, it may be possible to die from a broken heart, but it's not all that probable. One of my biggest goals with teaching in this lab and making online content is that I hope we can encourage people to develop a love of learning. And one of the things that I continue to use on my lifelong learning journey is Brilliant. We have been working with Brilliant for years now because Brilliant helps people to learn at every level. Whether you're in K through 12, college, or just love to continue learning, Brilliant has lessons for you, with thousands of interactive lessons in math, science, data analysis, and even AI, which has been really great for me because I'm obviously a little biased to the biological sciences. So refreshers in math with their calculus lessons and data analysis with their lessons on analyzing data visually has been amazing. And a lot of you watching us might be interested in doing something in the medical field. And trust me, part of your education will include math and data analysis. So you could definitely find lessons that can help you along with your journey. And one of the best things about Brilliant is how their lessons are presented in an engaging, hands-on format that helps you to become a better problem solver and thinker, so that you can apply your knowledge to real-world situations. And so if you want to learn for free on Brilliant, go to brilliant.org/IHA, scan the QR code on screen, or click the link in the description. Brilliant is also giving our viewers 20% off an annual premium subscription, which gives you unlimited daily access to everything on Brilliant. Thanks again to Brilliant for supporting the channel. Thank you to all of you for watching our content about the human body. And of course, we'll see you in the next video.